I'm 20 years old. I have a 2.5 inch long surgical scar below my left eye due to an accident when I was 5 years old. I recently had a CO2 laser treatment done on it. It's been 6 weeks post laser surgery, and the scar is still pretty red, though the depth seems to have decreased significantly. How long will it take for the redness to fade away, and also, how should I take care of it? Currently, I'm applying a sunscreen of SPF 50 plus, as suggested by my doctor.
Thank you for your question. In the question, the photos you submitted, you state that you're 20 years old. You are dealing with a 2.5 inch vertical scar under your eye in the cheek area, which you've had since you were 5 years old from an accident. That you underwent a CO2 laser about 6 weeks prior, and that you were experiencing some redness, although you have noticed that the scar is less deep. And you're using a SPF sunscreen to basically protect the skin. You're asking about redness and what to expect further. Well, I can certainly give you some guidance. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon, practicing Manhattan and Long Island for over 20 years. And I have considerable experience with the original CO2 laser, the erbium laser, and now fractional CO2 laser, which I use routinely in my practice. So I'm going to offer you some insight in a way I think when I look at someone like yourself, and the way I suspect your doctor was thinking as to the strategy for you. So to begin with, when you describe a scar can be a depressed scar like yours, which means it dips below the skin level, or it can be a elevated scar, it goes above the skin level. So in your situation, it looks like what you had was a depressed scar, and what your surgeon intended to do was to basically provide you with a reduction in the contrast between the depth of the scar and the adjacent skin by doing an ablative procedure. Now, there's also some potential collagen generation from the thermal energy delivery into the depth of the scar, so that you can actually get some elevation of the depressed part of the scar. Even though, from my experience, that's really not something that happens that much from just the use of a laser. Redness after a thermal injury, which is what a laser is, can go on for weeks and months. I think that what you have to get from your doctor is some idea of what to expect, but it's not unusual for someone to have redness 6 weeks out. I basically explain to my patients is you're red or pink mostly in the early part, and then it fades, and you can still have pinkness for a couple of months, but it fades more and more and more. Now, it is routine for me to combine the use of a laser with the use of platelet-rich plasma. I have found that in the effort to help advance the healing process, platelet-rich plasma has a lot of value in my hands when I do fractional CO2 laser. And there are often times when I'll actually combine the treatment of the scar with a PRP injection, or maybe even use a combination of platelet-rich plasma and a hyaluronic acid filler with the laser at the same time. There are more than a few ways to address these types of problems, but I think that you're probably on the right track now that you've seen an improvement. So I think it's very important, as your doctor recommended, to protect your skin and try to avoid undesirable secondary hyperpigmentation where the skin gets darker from incidental sun exposure, and that's the role of the SPF. Plus, I always explain to my patients, think of this fresh new skin as baby skin. So you want to protect it. You want to protect it very, very well. So I think you're on the right track based on just this limited amount of information. But I think you can also, in follow-up with your doctor, just get some ideas of what to expect and see how things look as time goes on. There will probably be some indication for other things that you can consider as the healing process continues. But in the meantime, just maintain communication with your doctor, and so that you can at least optimize the results of this procedure. So I hope that was helpful. I wish you the best of luck. Thank you for your question.